Hello and welcome to HIMSS TV. My name is Dave Moyle from OB Health News. I'm joined today by Kuldeep Singh, founder and CEO of Biofourmis. Kuldeep, thanks for joining us today.
Thanks, Dave, for having me.
Now, your company focused a lot on the remote monitoring, predictive care, and increasingly a little bit of digital therapeutic space. And as we all saw, 2020 was a gigantic year of change for the healthcare technology industry and adoption and acceptance of a lot of virtual technologies. As we're moving into the new year, what are some of the major trends that you and your company are keeping an eye on or predict will be major players in the year to come?
Absolutely. Dave, as you saw in 2020, because of the pandemic, the entire digital, health industry certainly fast forwarded, I would say by at least 5 to 10 years. And, various technologies, including telemedicine, saw a significant ramp up as, the pandemic hit. Many hospitals mandated that patients need to be, consulted using telemedicine. But gradually, as we started to see increase in telemedicine, one of the things or the trends what we saw was even though telemedicine increased, it started to come down. And it started to flatten, and primarily because clinicians are used to making clinical decisions, and just by a video call, that was limited what a clinician could do. And that's where we started to, I would say, Q3, Q4, we started to see, gradual increase in remote monitoring technologies so that clinicians would be actually able to use actual clinical data, monitored, so that they can make actual clinical decisions. So I think that trend is going to stick, the increased adoption of remote monitoring for multiple applications, all the way from acute and transitioning a patient to post. And as you know, just on the Thanksgiving, CMS even approved, reimbursement for delivering acute care into patients' home. And that's a big step towards bringing acute care into patients' home. In 2020, we saw close to 42% decrease in emergency room visits. And many hospital systems were, hit by that financially. And because of these trends of increasing, use of acute care now delivering at home, I think that trend is going to stick in 2021. So we'll see many more companies starting to deliver acute care at home, as well as hospital systems starting to adopt those technologies. And the first half of 2021, I think many hospital systems are going to make a decision to move in that direction. And then as you gradually transition to post-acute care, post-acute care has already been, many hospitals are already adopting it, I would say since many years now. But because of COVID-19, patients were not coming back into the hospital. And that fear, of the pandemic still exists. Even though we have the vaccine, we will still start to see, many patients being monitored remotely in their home. And one of the things I think which is going to start being more prominent in 2021 is not just leveraging your traditional blood pressure cuffs, weight scales, and your traditional analytics. I think the question would really become, how will hospital systems make their remote monitoring programs much more efficient and scalable so that they don't need to hire a lot of resources. And that's where I see, adoption of predictive analytics so that you're not actually just leveraging traditional, threshold analytics, but you're actually leveraging this continuous monitoring data, leveraging analytics so that you can predict disease rather than being more reactive and actually start to deliver care virtually. This is, a big step. And I think where we are in the digital health industry is many companies are doing, bits and pieces of this and trying to solve the puzzle. And, we saw a couple of acquisitions, consolidations in 2020. I see there will be much more consolidation happening in 2021. Some people are just building, devices. Some are building, software platform, but some are very focused on building building actual clinical services, that last mile of actual care delivery, and really, multiple companies coming together to target the market by bringing all the pieces together. I think that's increasingly going to be seen in 2021.
Generally, I would say I agree. But we're talking about a lot of the pushing forces that are forcing this type of change. But as we all know, doing anything in a hospital isn't as easy as one, two, three, especially when it comes to adopting entirely new systems, as you said, that are becoming increasingly from end to end as you see this type of consolidation. What do you think are going to be the major barriers or pushback to this type of adoption that you're describing and hoping that we'll be seeing in the years to come?
Yeah, no, absolutely. So I think the biggest barrier to adoption, especially in 2021, is really going to be hospitals have actually suffered, because of COVID-19, and there is decrease in revenue. So many hospitals are thinking about, what are ways, we can focus back on getting that revenue up, right? When a new technology comes in, there needs to be investment from the hospital system to start adopting for such technologies. So there needs to be investment made in hiring nurses, clinicians, setting up that entire operational infrastructure. And I think that's a key barrier, getting hospital systems to actually build out those clinical services to start leveraging digital tools. And that's where, as I mentioned, Dave, there are companies who are actually going and saying to hospital systems, you don't need to spend any resources. We will take over, the post-acute care or the acute care, and even leverage, our clinical services along with your clinical protocols and help deliver those. So I think the market is yet to be seen on how that will play out. But there are companies which are trying to, even go to the hospital system and bring those components together to them, so that there is, reduction in barrier to entry. The other one, I think, is going to be, after all, outcomes, right? You really need to demonstrate clinical outcomes, and digital health industry is just getting over flooded. So, the hospital systems really are going to look for which platform has actually demonstrated both clinical benefits as well as economic benefits. And that's where, it would be a distinction between multiple companies on who stands out and who will eventually get to work with these hospital systems.
I guess my final question is, these companies, what can they do? Companies in many ways in the same position as yours is, what can they do to insert themselves into the process? How can they get noticed by hospitals and work with them to make these implementations happen successfully?
Yeah, no, I think that there is no secret sauce to that. Every hospital system is different, but I think there are certain key principles, which are very useful, especially when you start working with hospital systems. I think the first one is really articulating what value proposition your platform has, and what value you're really trying to deliver to the systems. Is it a financial value? Is it better clinical outcomes? Really positioning your solution appropriately so that there is value to the hospital system. Second, I think there needs to be skin in the game, by the hospital systems or even customers like payers. And many digital health companies have started to leverage value-based reimbursement, risk-sharing models, so that there is skin in the game between both parties, which eventually results in higher adoption if the program is run successfully. The third one, I think, in digital health, it's not about one component of the product. It's about end-to-end service, right? Because hospital systems don't want to really work with multiple partners and bring the solution together. So I think, going to the hospital system with the end-to-end service, and really working with them to be integrated into their clinical workflows. Basic things like EMR integration, having the right security, privacy, compliance. Those are very important for hospital systems. And eventually, once you are deployed, making sure that you're continuously generating evidence and demonstrating that, because you don't want to start a program and eventually wait for a long time before you can demonstrate outcomes. So I think one of the things which it might be a good thing but bad sometimes is running small phase one or a proof of concept studies or programs, but having a commitment from the hospital systems that they're going to convert that into a longer term contract eventually, really has helped us, where we are able to very quickly go within maybe 3 months, demonstrate actual value proposition of our platform and the value to the hospital system, and then get those relationships converted into long 3-5 years kind of contract.
Awesome. Kuldeep, thank you so much for taking the time to join us today. It was great hearing from you.